Antiplatelet drugs. Antiplatelet drugs are used to reduce the platelet action to reduce the coagulation. So, in a clot formation, to reduce the clot, or for example, as a prophylactic purpose. So, during stunt application and all, there is a possibilities of formation of clots. So, to reduce that clots, we'll give the antiplatelet drugs. Means like that to reduce the clot, many drugs are there like anticoagulant drugs, thrombolytics. So this also one kind of drugs. Antiplatelets contains definition, classification, mechanism of action, pharmacokinetics, adverse effects, contraindications and uses. Let me discuss about the definition. Antiplatelet drugs. So these antiplatelet drugs also called as antithrombotic drugs. So these drugs will interfere with the platelet function or action and reduces the coagulation. So these drugs mainly used for a prophylactic purpose. Classification. So these antiplatelet drugs are mainly classified into 5 different types. The very first one is prostaglandin synthesis inhibitors. So this prostaglandin synthesis means these are the drugs which inhibits the prostaglandins like thromboxane A2 usually involved in the activation of platelet. So by reducing the or inhibiting the production of thromboxane A2, these prostaglandins, we can reduce the platelet action. Example, aspirin. Second class is phosphodiesterase inhibitors. So these phosphodiesterase usually activates the platelets. So by inhibiting the phosphodiesterase, we can reduce the platelet action. Example, dipyridamole. Then third one is adenosine diphosphate antagonist. Means these are the drugs which will act against the adenosine diphosphate. So this adenosine diphosphate will act as a signaling molecule for the activation of platelets, so that by inhibiting the ADP we can reduce the activation of platelets. Example, ticlopidine and clopidogrel. Fourth class will be glycoprotein 2b3 receptor antagonist. Means these are the drugs which inhibits the or act against the glycoprotein 2b3 receptor. So this glycoprotein 2b3 receptor will usually acts as a final step for the formation of clot. Like these receptors will bind the fibrinogen and converts the fibrinogen into fibrin. Fibrin is a final step of the formation of clot. So by inhibiting this receptor, we can avoid the final step of clot formation. Example, abciximab, eptifibatide and tyrofibran. Then fifth one is other class of drugs. Means you can see that prostaglandin synthesis inhibitors means here it inhibits the prostaglandins. Phosphodiesterase inhibitors will target the phosphodiesterase. Adenosine diphosphate antagonist will target the ADP. Glycoprotein 2b3 receptor antagonist will target the glycoprotein 2b3 receptors. Here these are the drugs which not target particular receptor or protein, but it inhibits the platelet action. Those we called as a other class of drugs. Example, PGI2, cilostazol and ridogrel. Let me discuss about the aspirin. Aspirin is a PG synthesis inhibitor used as a antiplatelet drug to reduce the platelet aggregation. Let me see the mechanism of action. Aspirin, here we are explaining the mechanism of action. If given low dose, what action it will show, and at high dose, what action it will show. Aspirin at low dose, it inhibits the COX-1. By inhibiting the COX-1, it inhibits the synthesis of thromboxane A2. So this thromboxane A2 is required for the activation of the platelets. Due to inhibition of this thromboxane A2 synthesis, there is a decrease in a platelet aggregation, so that it reduces the platelet action. This aspirin at high dose, it inhibits the COX-1 and COX-2. So by acting on cyclooxygenase 1 and 2 pathway, it inhibits the thromboxane A2 and PGI2 both. So by inhibiting the thromboxane A2, it decreases the platelet action. By inhibiting the PGI2, it increases the platelet aggregation. You may ask, aspirin were used as an antiplatelet. So why it increases the platelet aggregation? Because this PGI2 naturally will act as a reduction in the platelet aggregation. But aspirin, when we given at high dose by acting on COX-2, again it inhibits the PGI2, so that there is an increase in a platelet aggregation. So usually aspirin will prefer at a low dose, because we need only decrease in a platelet aggregation. You may observe in a market ecosprin are available. This aspirin is marketed product is ecosprin 75 150, so that will be a low dose. At low dose it inhibits the thromboxane A2 and decreases the platelet aggregation. It doesn't cause any increase in a platelet aggregation. So ecosprin usually used with the patients who have cardiovascular diseases as a prophylactic purpose to reduce the clot formation. Will use the aspirin. Pharmacokinetics. So this aspirin is administered orally. Usually it is metabolized in liver and excreted through urine. 50 to 60% of the drug will bind the plasma proteins. Adverse effects. So this aspirin causes the gastrointestinal bleeding. So why it will cause gastrointestinal bleeding means it damages the inner lining mucosa of the stomach, so that it causes gastrointestinal bleeding, ulcers. It may cause ulcers. The second one is large doses will cause the temporary tinnitus. Large doses means high doses, more than 300 400 mg doses will cause the temporary tinnitus, means until the action of the drug is present in the body, it will cause tinnitus. Once we stop the medication, automatically it comes back to normal. Tinnitus means there is a ringing sound in the ear. There is a ringing sound, like train is going, some ringing sound will observe. Next side effect will be Ray's syndrome. Ray's syndrome is a very rare and life-threatening disease condition. Usually it occurs in a children. So usually the children who have viral infection or chicken pox, in that condition, if we administered aspirin, it may causes the swelling of the brain and liver. So that condition we call as a Ray's syndrome. Next will be allergic reactions. So aspirin, it cause the hypersensitive reactions. Then contraindications, when we should avoid in case of asthma. So why we should avoid in case of asthma means the patients who have asthma already, they have a bronchospasm and difficulty in breathing. If you administered aspirin again it will cause the bronchospasm, so it causes asthma attack, so that we should avoid in case of asthma. Second one, gout. So we should avoid in case of gout. You know well that gout is a increase in a uric acid levels in the joints. So it may cause arthritis. So gout is a condition, there is an increase in a uric acid level. If we administered aspirin, again aspirin will reduces the excretion of uric acid level. So there is a again increase in a uric acid level. It worsen the condition, so that we should avoid in case of gout. Next is mild diabetes. So why we should avoid in case of diabetes means usually it causes gastrointestinal bleeding in case of the persons who have diabetes, so that we should avoid. And sometimes it may cause acute renal and liver damage, so that we should avoid in case of mild diabetes. And also in case of kidney diseases. So kidney diseases means already the kidney have not working properly. It is a dysfunction, it's not working properly. In that condition, if we given aspirin, so it may worst the renal function and also cause the bleeding risk. So we should avoid in case of kidney disease. And also we should avoid in case of hemophilia. So hemophilia means it's a disease where lack of coagulation factors and bleeding will be there, means blood immediately it won't clot within the normal clotting period. So if you are given aspirin, again it acts as an anti-platelet, so it reduces the platelet action. So there is a huge loss of blood, means excessive bleeding will happen, so that we should avoid in case of hemophilia, or should take a precautions. Alcoholics. So we should avoid in case of alcoholics, because it causes the gastrointestinal bleeding, stomach ulcers, acute liver or kidney damage, so that we should avoid in case of alcoholics. Next will be uses. It is used in the treatment of myocardial infarction, stable angina pectoris, unstable angina, and coronary artery angioplasty. So in these conditions we'll use for a prophylactic purpose. Vascular graft. Vascular graft means if any damaged blood vessel will be there, means it will be replaced with the artificial one that we call as a vascular graft. And stent application. So if the coronary arteries, if any blockage will be there, so to easy flow of blood will you apply the stent will be used there. So during stent application also, to reduce the clot formation, we'll use the aspirin. And also it is used in a coronary bypass grafting, peripheral vascular disease, prosthetic heart valves, arterial fibrillation. Arterial fibrillation means there is a irregular and fast heart rate. So in these conditions, to avoid the formation of clots, we'll use the aspirin. And also in case of hemodialysis, again here prophylactic purpose, cerebrovascular disease, stroke. So usually stroke will happen due to hemorrhage or bleeding in a brain. So to avoid the clot, we'll use the aspirin. And also pulmonary hypertension. So there is a high blood pressure in a lung arteries. So in that also, to avoid the clot formation, we'll use the antiplatelet drug aspirin. Thank you.